It's our final stop in our head-to-toe journey in cancer prevention. It's the most commonly diagnosed cancer, and it's mostly found on the legs in women. And I'm talking about skin cancer. So where's Lisa? Lisa, come up and join me, Lisa. How are you?
Hi.
Come on up. Thank you very much. So, you got a question?
Yes. First of all, I wanted to thank you because I believe you saved my life.
Goodness.
A few months ago, I was watching your show about molds, and I recognized one of the molds that you showed as melanoma as being something that I saw on my leg. And because of that, I went to my doctor. He referred me to my dermatologist, and sure enough, it was melanoma.
Oh, you're kidding me.
Yes.
And you had it taken out?
I had it taken out about 9 weeks ago, and now cancer-free. And
You know, this whole show is about you multiplied by everybody watching.
Yes.
Because you know what? You're very kind in saying that I saved your life. You saved your life. You know, because you paid attention, and you took notes, and you figured out how to apply it to yourself. And you know, all the doctoring we can ever try to do, and I don't care how great the doctors were to took care of you, the biggest advantage they had was you coming in early. So congratulations for being such a smart person.
Thank you. Thank you.
So what's your question?
I wanted to know what I can do to prevent the melanoma from coming back, and what precautions I should take going out in the sun.
Well, what I love about doctors who've been through the problems is they know a lot more than people who have book knowledge. So Liz, take it away. How can we prevent skin cancer?
So, Lisa, the #1 way to prevent melanoma from spreading throughout your body is to be proactive. The key is change. That's often the first warning sign that it could be a cancer. But if you can catch it, if you can catch melanoma in the earliest stages, it's almost 99% treatable.
Good.
So we're going to examine you right here. Oh. No. We've got a demonstration. I've got something in store for you, so I want you to come up here and join me. So, you know, I love talking to folks about what's really happening with these different ideas and words that we talk about, in this case, melanoma or skin cancer, because if you actually see it, then it changes the way you think about it. So this is typically what happens early in the life of a skin cancer. It's pretty superficial. Go ahead and feel it there, and it's raised, and you can appreciate it. By the way, as we probably discussed in the show that you're referring to, it's not symmetrical, right? The border's weird, the colors aren't the same. You know, this is the kind of thing that gets us a little bit nervous, right? And the diameter is bigger than you would want it to be if it's, you know, because skin cancers tend to be larger than the back of a pencil head. Okay, now, go ahead and put your gloves on. What ends up happening is that the tumor is very small. It has to start somewhere, right? It starts with one cell. And one cell is not going to kill you. But as it grows, several things begin to happen. It begins to get irritable. And as it gets irritable, it starts to spread. You see that? As it spreads, it starts to go out in little pathways. And then something very important happens. It'll start to spread over here on its surface. And these we won't even see. They're superficial. And then something else happens. I want you to look underneath here. The cancer suddenly gets into the bloodstream. You see that? And as that happens now, even if we're cutting out the superficial area, right, and taking it out, the cancer's traveling. It's impossible for us to keep up with them unless we actually can get to it either through some novel, cool, breaking, cutting-edge therapy, or because someone finds it early, usually because they look themselves. Okay. So thank you for doing what you're supposed to do.
Thank you.
All right.
Thank you.
Now, last question for you. As you know, for most skin cancers, not necessarily melanoma by itself, but for most skin cancers, sunscreen, sunscreen, sunscreen is the best way to reduce exposure. So I suspect you use some sunscreen.
Always.
Perfect.
Always have.
And how powerful?
30.
Perfect. I love it.
Okay.
She's an expert. She's become a world expert on her body. I want to thank Dr. Sterling Schreiber, Dr. Richardson Heron, and Dr. Elizabeth Tanzi, and to everyone who asked a question. We'll be right back.
Thank you.